Mike, one of the best stories we'll tell you about all day. Lurie Children's Hospital has now performed, get this, its 400th heart transplant. The recipient, just 2 years old, little Delilah Edwards of Moline. Before she was born, she was diagnosed with not one but two congenital heart conditions. She spent most of her young life in the hospital. Then, last month, her parents got the call they've been waiting for. A heart was available.
And what's so amazing is that now Delilah is going to celebrate her third birthday, which is Saturday, with a much brighter future. And two of the men that made it happen are Doctors Philip Thrush, he's the medical director of Lurie's heart transplant program, and Dr. Michael Mongé, he's the surgical director of Lurie's children's heart failure and heart transplant program. Thank you, gentlemen, for coming on. We do appreciate it.
Good morning. Good morning. Thank you.
Okay, this is amazing for so many reasons because of this young girl and the future that she's going to have now. But we understand that this was the 400th heart transplant, and to know that it went to one with such a bright future now, I mean, how does it make you feel to know that you guys have come this far?
I think it's amazing. I mean, we look at where this program has come over the last 3+ decades, and from Dr. Mavrudis and Dr. Backer and Dr. Paul, who really established this program and built it to what it is. For Dr. Mongé and I to lead this program now and to cross this milestone, it's truly amazing. And it full credit goes to the entire team of people. We get to sit here and talk to you guys today, but it takes so many people to have these successful outcomes.
Boy, we're looking at these happy faces. Just the rewards. I can't even, come up with the words to describe what it must be like for you to be involved in this. Dr. Mongé, I want to ask you, we just said goodbye to October, Breast Cancer Awareness Month. We know that amazing strides have been made on that front. We don't often talk about the strides made in heart transplants. If a 2-year-old girl like Delilah gets a heart, what does that mean for her life expectancy?
So for Delilah, we have made strides in the longevity of the donor graft, and so Delilah would expect this heart to last at least average of 15 years or more, and then Delilah would need another transplant at that time. But there's ongoing research here at Lurie and other institutions around the country to try and prevent transplant altogether, but also to try and maintain the longevity of these donor hearts and quality of life of patients like Delilah. It's just remarkable to see how far she has come. She was transferred into our institution back in March and was quite sick, and we were able to support her with a mechanical pump for months and months, and then a great heart became available, and it was just a remarkable experience participating in her transplant, but all these all these transplants over the years, and now to see her up walking without a pump, getting ready to celebrate her third birthday. We're gonna have a big party here at the hospital, and then looking forward to seeing her outside at the playground across the street. It's just that picture right there sums it up. She's smiling. That's 3 days post heart transplant. She's walking, and just the resilience and courage that she and her family have. It's just wonderful.
Well, Dr. Rush, I'm asking you right now, and Dr. Mongé, you could weigh in really quickly. We're running out of time, but I just want to ask you, you guys, what you do is just so amazing. You help people get the gift of life, but is there ever any moment in those surgeries where you're implanting the heart and you're just holding your breath and you're waiting for that heart to take hold, and you're just like, are there any moments where you're just like, oh my gosh?
I mean, I think there's probably always some moment of hesitation and anticipation, but thankfully our surgical team is amazing, and it's that sense of relief when you see the heart start to beat and start to pink up, and know that you've crossed that hurdle and you're starting at least the back end of the transplant and the recovery.
And I participating in my first heart transplant here as a medical student back in 2003, and watching that donor heart wake up and start beating again, it still doesn't get old almost 20 years later.
That's so awesome.
I can imagine. We've got to end it there. Doctors Mongé and Thrush, thank you, gentlemen.
So cool.
Keep up the tremendous work there at Lurie's. Let's go to Jake.